Hi, my name is Santhosh Thomas. I'm a fellowship-trained interventional physiatrist and I work at Cleveland Clinic.
Hi, I'm Kush Goyal. I'm also a PM&R physician, fellowship-trained, and am at staff at the Cleveland Clinic.
So Kush, when you were looking for your fellowships, what were the important categories you were looking for?
So when I was applying to fellowship, there were really ACGME accredited pain fellowships and various non-ACGME accredited fellowships. Now, in the last few years, there's a NASS Interventional Spine and Musculoskeletal Medicine Fellowship Consortium. So currently, there are 21 approved fellowships and 5 provisional fellowships. So there are a little bit more options of fellowships that are all in the same academic or academically based programs. Should I explain some of the what makes NASS ISSM fellowship?
Sure.
Okay. So some of these programs have the program directors or faculty who are writing book chapters, peer-reviewed journals, are part of our societies, who write guidelines, are teaching some of the cadaver courses for our fellows and residents, as well as holding leadership positions and membership positions in our international spine organizations. And based on inclusion criteria are how you get into the NASS ISSM fellowship. But there are a lot of reasons or a lot of things to look into when you're applying for a fellowship. So do you remember how important location and finding a job was for you?
When I was applying for fellowships, there were not that many, so we were happy to get any interviews, and if we were accepted, we were happy to move to any location. It could be south, north, cold, warm. That has changed a lot now. You have some more options at this time. There are a lot more fellowships that are available that are well trained. It all depends on what you're looking for. Ultimately, it's your choice where you want to be and what you want to learn. You have to know what your priorities are. My priorities may be very different than Dr. Goyal's priorities. He may want to be in Cleveland or in Tampa, or he may want to be in Boston. It's hard to tell what he wants, where he wants to be at the end of the rotations and when he starts his career. Typically, it's best to try to do a fellowship that allows you the opportunity to maybe establish yourself there, or if you already have plans to move to your hometown or another city, have contacts and plan on moving to that area. Make sure you apply for your licensures in advance. Make sure that you do due diligence. There are a lot of fellowships that will promise you a lot of things, but you may not get it. Recognize that some fellowships you are a revenue generator. Some academic places will not have that. They are fully funded and they'll take care of your stuff. So basically they're there to teach you to make you good physicians. So you have to understand what you want to learn. There are places where they'll say that you'll do spinal cord stimulators all day. If that's not your interest, then you don't need to do that fellowship. If you feel like you want to learn bread and butter, there are a lot of places you can do that. A lot of the learning is going to come from your own efforts. That's going to be important for you. A lot of the fellowships will have a lot of resources. An academic institution will likely have a lot more to offer. Things like formatted lectures, cadaver courses, different faculty, complicated and complex patients. So there's a lot of advantages to each group that you are looking for, but make sure you do your research.
Those are all excellent points. One thing I want to touch base on when I was applying, it was really, again, ACGME or non-ACGME. So one advice I got from one of the former past or presidents was it's important to work at an institution that also potentially where you work at may have an impact of where the job opportunities may improve. So if you work at an institution that's well recognized nationally or internationally, even if it's non-ACGME accredited, that may carry a lot of weight in terms of finding a job around the country.
So you'll see that in many places, employers may be asking, are you ACGME certified? In some cases you may not be, but you may be coming from a world-class institution that has all the training that's available, and that oftentimes actually supersedes all the other things, because the reputational quality of the cases that you'll see at these institutions are going to be tremendous. This spectrum of pathology is tremendous. They'd much rather have that than somebody who took the exam and said, I took the ACGME fellowship and passed the test. Having said that, there's nothing wrong with looking for those also. It all depends on where you want. Some employers may prefer that you're certified so that it's a little less of a turf battle between you and another person who's ACGME certified. However, your skill sets will eventually win out, and you will see that where you're trained and what you know is going to help you the most.
Yeah. In addition to that, there are alternate certification exams that can be taken. I've heard of the American Board of Pain Medicine is another exam that can be taken for non-ACGME accredited spine or pain medicine fellowships.
Another thing to think about is when you do your fellowship is how many faculty members you have there. Are you with a solo practitioner, or are you with a large group of providers who trained at different places and bring in different skill sets and interpretations of procedures? Because at the end of the day, it's best to have multiple tools in your possession. If you only work with one person, the drawback is that you only know one option. So if you have worked with providers who are vastly different, however, do similar stuff, you will have a very good way of managing your patients, because the patients are going to be complex. They're not all going to be straightforward cases, and you'll have to know how to manage those things. It also helps to know that the kind of procedures you'll do. There's a difference between quality and quantity of procedures. A lot of institutions will let you do your own procedures or fellowships early on. Some will hold your hand a little longer. It's important to know that supervision matters, because you can train a lot of people to drive a needle, but you really need to know the indications and how to deal with complications. So it's really important to sort out what kind of cases you'll be seeing. There's a spectrum of it. If you do only lumbar stuff, well, that may not be the place to be. If they only do spinal cord stimulators, that may not be the place for you. But you should be trained well, because ultimately you need to market that for your patients.
Yeah, I'm going to emphasize that part again. It was a great point. In preparation for this, I polled about 20 or 30 former fellows. Some were in our fellowship, some were in different fellowships, some did an anesthesia pain fellowship. And really the main thing that I got that was a clear theme was working with attendings, with multiple attendings to, again, learn the different approaches. I think it's very important to learn, again, different techniques, but also learn on different ways to what to do and what not to do during procedures, and really what patients not to do procedures on. So I think it's very important. With the more exposure you have, the more well-rounded you'll be as a physician when you're seeing these patients on your own.
So I'm a co-director of the fellowship, so when we interview our fellows, we kind of gauge their interest in what they want. And sometimes it's very easy to say that this person does not fit our choices, only because they come in and say they all want to do neuromodulation all day. Well, in some places, that's not the focus. But we can teach you those things, but if they insist on that that's what the practice is, we very politely tell them this is not the place for you, because it's best that, you know, the year or two that you spend is a happy year for you, or two, and that you learn and you get what you are spending your time and commitment. So it's really important for you to know what your attendings will teach you and what the practice is all about. Now, surely there's some changes over time, but it should not be drastic. Another thing to look for is stability in the program, and see what the turnover of physicians are. And some of the institutions have people working there for 20 years plus. Some will have empty spots where, you know, you go in for the interview, the attending doesn't tell you that they're leaving, you show up, they leave, now you're with one or two other people. So make sure that you know all the details of this stuff. Another way to confirm your thoughts is to talk or pull information from other fellows who graduated from that program. A good program will give you access to all that information, because there's nothing to hide, right? We're happy to have you interview our fellows. When you come for interviews, you meet with our fellows. You can ask any question. They're not scripted. They're free to answer your questions, because ultimately you need to be happy with what you do.
So another theme that I got from our former fellowship survey was, again, as Dr. Thomas mentioned, quality, quantity, and also variety. So some of the core things that most of these NAS ISSM fellowships do are sacroiliac joints, lumbar facet injections, lumbar facet RFA, cervical facet injections, medial branch blocks, and RFA, as well as intra-articular hip injections, cervical transforaminals, lumbar transforaminals, and interlaminars, cervical thoracic, lumbar spine, and caudals. But there's becoming more variety year to year that a lot of our young residents are interested in. So some things that you may want to ask about are, is there exposure to ultrasound, exposure to peripheral nerve stimulation? We had already touched about spinal cord stimulation, vertebral augmentation, other peripheral and joint injections or peripheral anesthesia procedures like plexus blocks. So a lot of fellowships may provide you exposure to everything or a middle ground or very little. But it's important to really choose a fellowship that's appropriate for you based on what you want to do, after you graduate from a fellowship.
So another thing to think about is how much sports and spine you want to do. Some fellowships will be very focused on spine, some will be very focused on sports. And there's some situations, there are some situations where they do both. You can be experts at many of these things, but it's going to require time commitment. Sometimes a year is not enough to be a master of both sports, and all of spine.
Yeah. Another thing to look at is, even if you're in a fellowship that is academic or a private practice, you want to look at what are they going to teach you within your fellowship. So there are some fellowships where the attendings had done private practice previously and now chose a more academic model, or vice versa. So I think there are a few things that you can learn from both, but it's important to know what you want to do as you go forward.
So when you apply for your fellowships, make sure you know what you're getting into. Make sure you know what your interests are, location, your educational details, what opportunities you have in terms of lectures, cadaver courses. If you have access to national organizations, your faculty involvement with those things, because that'll make it easier for you to get involved with those things. Your patients will be ultimate educators, so the more you see, the better you will be for the long term.
And more recently, we've started a NASS-recognized International Spine and Musculoskeletal Medicine Fellowship, or ISSM. So there are certain criteria for being part of this NASS consortium. The point system often continues of faculty who are involved in academic work such as peer-reviewed journals, book chapters, leadership in the organizations, grants, as well as teaching cadaver courses. The list or criteria are available on the NASS website. I think this is a good resource to see what makes up a NASS approved fellowship, as well as what things you can be exposed to during a fellowship with your different faculty.
Many of the programs will have a very broad approach of addressing patient needs. Multidisciplinary medicine is the way to go at this time. Some programs will have OMM, some will have acupuncture, some will have chronic pain programs, some will have psychology only. So make sure the program you're looking at has access to some of these things that will make your training better.
Yeah, including exposure to McKenzie certified physical therapists, as well as exposure to spine surgeons. I think it's important when referring to surgeons to actually work with them in training, so you know how to communicate with them and how to appropriately refer patients.
In some programs, you work side by side with the surgical physicians, so they know what they want to do with their patients, but they would like your help in sorting out some of these details. So they will also teach you the indications for surgery, which is absolutely critical, because sometimes you're doing procedures to sort out if it's a surgical patient or a non-surgical patient. So having surgical colleagues in a symbiotic relationship is very helpful.
And also there's a variance in autonomy, what I've heard from different fellowships. Some fellowships you may not have a lot of initial practice with the needle on patients, where you may not be being a solo. You may not be doing the procedure in the first few months. Some you're getting exposure from day one. Some I've heard of fellowships where you're being trained for about a week, and then the attending may not even be in the same building or same city.
So that's a very important point that Dr. Goyal brings up. It is not uncommon for us to hear from fellows that they are involved with the fellowship, but the attending is not there to help them. What they've done is trained one fellow, and the fellow ends up training the next fellow. Was that what you really want? If that's the case, you may not be getting what you paid for. It's always important for you to recognize that that is a concern you should have when a fellow who is in training is training you. So, but I just wanted to make sure that we clarify that, all right?
Yeah. A few other things that I've heard that from former fellows, that they were looking for programs where they weren't doing weekend call or weren't doing clinics on weekends. or having to do inpatient rounds. So some programs is a part of their fellowship, and some are not. So those are other questions you can ask when you're going through the interview process.
If you have any questions in the future about any of these things, Dr. Goyal and I are available for you. You can find us through NAS or just Google us and we'll be able to help you.